Today we're going to go into what's called the blended hybrid margin. And so what it's for is for onlays or overlays. Whenever you have your porcelain margin on the side of the tooth and you don't want there to be a clear delineation line to where the porcelain stops and the tooth begins. So if we look at this patient here, what we have is this is a patient who came in from another office and she has this overlay or onlay or whatever you want to call it. And well, first of all, there's a huge ledge there, but the biggest thing for her is that she can clearly see where the porcelain stops and where the tooth begins. So it's not a very well blended transition. So as clinicians, we have the decision of whether to do a fully porcelain buccal crown, right? We can either extend the margin all the way to the gum line and then we can have the entire tooth be porcelain, or we can have it stop somewhere near the top or near the bottom, somewhere on the facial area, but then there's that line where the porcelain stops and the tooth begins, which patients don't like. So then you have the issue of trying to do minimally invasive dentistry, but you have some aesthetic concerns, right? And so it's a very common issue that we have. And there are, obviously you can do like layered feldspathic or even layered emacs, and they can blend a translucent, and they can blend that transition with translucent porcelain. But then it becomes very expensive to do everyday crowns, right? Then you're having to send out and paying your veneer cost for a regular, this is number 14, right? So you'd have to paying, waiting 3 weeks, 4 weeks, and getting that expensive porcelain that's blended for this posterior crown for a minor aesthetic concern, right? So this patient was very bothered by it, but it's not really showing too much in their day-to-day. So this is a technique that allows you to still use your milled emacs or whatever you use, your solid block of porcelain, and you still can get a perfect transition line. So this is the after for that patient. So that patient came in, her main concern was that she could see this huge line and she could feel it with her tongue, right? The feeling with her tongue, that's an easy fix. We can just smooth it out. But to get this transition where you now can't see where it starts, you can here because this we did after the fact. If this was pre-planned and we did this beforehand, we wouldn't have this here either, but we'll show you all of that here. And so this is, we didn't numb her. This took 15 minutes and the patient is very, very pleased. And so are we as clinicians because we didn't have to cut any of this buccal, and it actually ends up blending better. If we were to do this entire tooth in porcelain, then it would be kind of like number 15 here, where number 15 you can't see a transition line, but it definitely doesn't match number 14. So if we did a full crown on number 14, you wouldn't be able to see the transition, but it wouldn't match number 13, especially when she has this kind of grayish color to her teeth. We wouldn't be able to match that with porcelain. But here, if we get rid of this section that we couldn't fix because this was just a touch-up job, but if you look at this part of the tooth here, you can't see it at all. They still get their natural color of their tooth. We didn't have to prep as far, so it's going to last longer. We didn't affect the pulp. So it's a very, very easy way to blend your porcelain. And so it's called the hybrid approach because it uses composite to do this blending. So I'll show you what we did for this patient, and then I'll show you what we do when we're planning to do this, and so if it's our patient and we prepped this crown. So for this patient, she came in like this, and then all we needed to do was create a little bevel here on tooth and porcelain. One thing to note that this needs to be done on porcelain that you can bond to, and I say you can bond to because for me, that means not zirconia, right? That means it's either the lithium disilicate or feldspathic porcelain. If you feel confident in your bonding to zirconia, you can absolutely do this. I personally do not. So whatever you can bond to, but you need to be able to bond to both the tooth structure and whatever material the crown is. So when this patient came in, we didn't get her numb. All we did is we took a round burr. And we took the round burr and we prepped right there. So we prepped enough so that there's a little bit of a bevel on the porcelain and a little bit of a bevel on the dentin. And then we have good isolation, especially because we're using phosphoric etch, so it's a little risky to use in the mouth, so we want to have really good isolation. And we put the phosphoric etch just on the porcelain, the hydrofluoric acid, right, the porcelain etch just on the porcelain. And then we put the phosphoric etch just on the dentin, let that sit. You put the hydrofluoric etch on there first because it needs to sit there for about 2 minutes. The phosphoric etch just needs to be about 45 seconds. This should all be an enamel, so it's not a huge deal if you're over etching. Then you wash that off. I will put silane on the porcelain. Then we put our bond on there so that everything's ready to bond. And then you put composite in this area. That's why it's called the hybrid, because you're using composite to layer the porcelain to the tooth. I use one of the chameleon composites. Those are the best for this. So you can use like Omnichroma, or there's tons of brands out there, but the composites that boast about being one shade. So those composites are really good at reflecting light so that everything blends. You can just use, if this was an A2 tooth and an A2 porcelain, you can just use an A2 composite because it's much more translucent than the porcelain and the tooth, so a thin layer of it will still get you this blending effect. It's much better to use the chameleon composites like the Omnichroma or any of those brands, but any composite will work. And so all you do is you put your composites in this area, overfill it a little bit, cure it, and then polish it off, and it will create this hybrid blending layer that perfectly blends everything. Some things to look out for is you can't make this too deep, right? This needs to still be an enamel. You need to still have your porcelain bonded to enamel, so you're just doing an outside layer. You don't want to do a huge divot or it'll affect the strength of the tooth. And this will give you this amazing blend from tooth to porcelain where it's unnoticeable by the naked eye. Now, if you're doing this yourself, you're prepping the tooth, that's ideal because you can set up the stage a little better and then you don't have this bigger chunk on the interproximal that you can't see, right? We didn't want to bring a big round burr into the interproximal here because you'll hit the adjacent tooth. It's just a little tricky to do, and since this isn't our crown, we're not going to take any risks to fix someone else's work. But if this was our tooth that we were doing ourselves, it's best to make these adjustments in the porcelain before you bake it. So before the porcelain is baked, when it's still in the purple form, you can make adjustments to it without risking making micro fractures to the porcelain. So you can do it once it's baked. It depends on your lab situation. So if you have a really good lab that you love and they love you and you work well with them, you can explain what you're doing and they can make it work for you. If you don't, then sometimes you need to make these adjustments to the already baked porcelain, which is totally fine. Just be very careful. Don't want to push too hard when you're adjusting the porcelain. But if you were to do this, ideally what you want to do is you get your prep, scan your prep so that they have the proper finish line, and then you make a little bevel in your prep to allow for this hybrid layer of blending. So if this is your tooth, you've prepped it, you have your margin here. This is the margin marked in pencil, right? So you have your margin already. You would scan this or take your impression so that the lab knows exactly where your final margin should be so that they can shape that contour perfectly. And then you go back in and put a little bevel here. And so you can see on this prep that now we can easily make this bevel go as interproximal as we want, right? So it wouldn't be like this before example where we can see the line here, because since we're doing it before we seat, we can put this bevel all the way around the crown if we really want to. And so now you have this bevel in your prep, and you take another scan or another impression to send to the lab, right? This is the ideal way to do it. You do not need to send this second impression, but that's ideal. If you send this second impression, then what the lab now has is they have where your prep finishes, where you want your crown to start, and where your bevel is. And then what they can do is make the crown off of the first one and bevel it back, right? If you're doing these porcelain yourself, what you want to do is mill your porcelain with this proper contour. You don't want to start your margin from this beveled point because it's harder to get the proper contour. So it's better to mill it with the proper margin, and then you just take a burr and you just give it a little bit of a bevel right here. And so now you have this bevel. You make sure to etch this bevel too. And then when you go to deliver the crown, you deliver it with your regular composite or your cement, put it in, wipe that line, wipe this margin with a micro brush, put your composite down on that layer, and then cure your entire cemented crown, right? There's a bunch of ways to do this depending on your workflow, right? You can bond it on first, and then you can prep the extra cement off and then bond on your layer, or you can do it all at once, right? And if they send you this crown just as is and you're only sending them the first scan, then all you need to do is, before you cement it, is bevel that margin, re-etch that margin, and you'll have created your bevel. And it's a very easy way to allow you to get these perfect margins without getting layered feldspathic porcelain to blend it and make it look perfect, right? Obviously, using fully porcelain to blend that margin is more ideal strength-wise, but it's very, very minuscule. This technique doesn't affect the strength of the tooth at all, and it's much more efficient, much more cost-effective for the patient, and still gets these beautiful, beautiful results.